Hello everyone. So in this video I'll be talking about the ECG leads. So we place various electrodes on the limbs of the patient and in the precordium region, and we get various electrical pictures of the heart, which is known as the ECG leads. A standard ECG has 12 leads which give the 12 waves of the heart. We have got limb leads which view the heart in the frontal plane, like you can see in this picture, which include the standard bipolar limb leads, also known as Inthorn's leads, which are three in number: lead 1, lead 2 and lead 3. And in limb leads we also have augmented unipolar limb leads, also known as Goldberger's leads. They also are three in number: AVR, AVL and AVF. Then we have got precordial or chest leads, which are also known as Wilson's leads. They view the heart in the horizontal plane. They are 6 in number, numbered from V1 to V6. Then there is a phenomenon known as volume conduction, which states that when there is electrical activity that is generated within the heart, it will reach the acromion, and the amplitude that is present at the acromion of the electric current will be same as that's present in the wrist. So we can place the electrode at the acromion also, and we can place it at the wrist also for the sake of convenience. Then if I talk about the standard bipolar limb leads, in it both the electrodes are active, and what is measured, that is the difference in the potential between the two electrodes. Like in this example, the negative terminal has plus 2 volt voltage and positive one has plus 5. The difference between them is 3 volt, which is the major potential difference. If the negative electrode is placed on the right arm and the positive electrode is placed on the left arm, we get lead 1. Likewise, if the combination is right arm and left leg, it is lead 2, and if it is left arm and left leg, it is lead 3. You can remember it by the mnemonic ride your green bike. It is the basically placement of these electrodes starting from the right arm in the clockwise direction. We have red, yellow, green and earthing electrode, which is the black electrode. Then talking about the Inthorn's law, states that if these lead 1, lead 2 and lead 3 they form an equilateral triangle with heart at the center of the triangle. By the triangle law of vector addition, or just by displacing or parallelly shifting the vector 3, we basically get this, that the potential of lead second is the sum of the potential of lead 1 and lead 3. Then we have got augmented unipolar limb leads. Augmentation means increase in the voltage so that the waves and complexes, they become easily discernible. Augmentation is done 1.5 times in case of these unipolar limb leads. So augmented potential would be 3 by 2 of the voltage of non-augmented leads. So how these are placed is, we basically have two electrodes here. One is the indifferent electrode, that is the fixed electrode, has potential of 0. And then we have the active or exploring electrode. If active or exploring electrode is placed on the right arm, we get the AVR lead. If it's placed on the left arm, it is AVL. And if it's placed on the left leg, it is AVF. So these AVL, AVR and AVF are aligned at an angle of -30, -150 and 90 degree to the lead 1. Then we have the axial reference system, which is the combination of the limb leads, the lead 1, 2, 3 and the AVR, AVL and AVF. Here AVL and 1 constitute the left lateral limb leads, AVR constitutes the right lateral limb lead, and 2, 3 and AVF are the inferior leads. Then precordial or chest leads, how they are placed is, we combine all right arm, left arm and left leg leads, and we connect all of them, and that forms the central terminal of Wilson, that is placed connected with the negative terminal of the voltmeter, whereas the positive terminal or the active or exploring electrode, it is placed in the various regions of the precordium, and they constitute the V1 to V6 leads. If it's placed on the right side of the sternum in fourth intercostal space, that is the lead 1. If it's placed in the fourth intercostal space on the left side of the sternum, that is lead 2. If it's placed in the left mid-clavicular line in the fifth intercostal space, that is lead 4. If it's placed between lead 2 and lead 4, it is the lead 3. if it's placed in the left anterior axillary line at the same level as those of lead 4, it is lead 5, and the lead 6 if it is placed in the left mid axillary line at the same level as the lead 4 and lead 5. Here is summarized version of these waves and leads. Anterior wave is constituted by the V1 to V4, posterior inferior by 2, 3 and AVF, left lateral by V5, V6, 1 and AVL, and right lateral by AVR lead. Then we have got some extra leads, like for the detection of right ventricular inferior wall MI, we have right-sided leads. The placement is same as that of left precoidal leads, but on the right side of the chest. Then for the detection of posterior MI, we have got posterior leads, V7, V8 and V9. And here you can see the summarized version of all these leads.